Have you ever stopped to think about how quickly artificial intelligence is becoming part of, well, everything?
It really is advancing fast.
Yeah, and it's
Yeah.
moving into pretty much every sector, right?
Yeah.
But maybe nowhere is it more critical or maybe raises more questions than in healthcare.
Absolutely.
So what do the actual people on the front lines, the doctors, nurses, IT folks in hospitals, what do they really think about AI? That's what we're digging into today.
Exactly. And for this deep dive, we're looking at a really insightful qualitative study.
Okay.
It's based on detailed interviews, questionnaires too, with 21 healthcare and IT professionals. Good mix.
21 people right in the thick of it.
Right. And the goal was basically to get their direct take on AI, how it's being used now, where they see it going, the good parts, the tricky parts, and definitely the ethical side of things.
Okay, let's jump right in then. Where are these professionals actually seeing AI in action, like in their day-to-day work right now?
Well, it's interesting. It seems pretty concentrated in some specific high-impact areas.
Such as,
Personalized medicine came up a lot, about two-thirds, like 66.7%, mentioned seeing AI, tailoring treatments based on unique patient data.
right, using genetics and things like that.
Exactly. And almost as many, about 62%, mentioned drug discovery and telemedicine. Those were big ones.
Telemedicine makes sense, especially lately.
Definitely. And beyond that, they also pointed to AI in clinical decision support, helping doctors make sense of huge amounts of data for diagnosis, plus guiding medical treatments and even helping out in complex surgeries.
Okay, so it's already touching some really critical points of care. What about the benefits? What are they actually seeing as the upsides?
Oh, this was pretty clear. A huge majority, 81%, pointed directly to increased efficiency and productivity.
81%, that's massive.
It really is. Think about the pressure healthcare systems are under. AI helping with efficiency isn't just, a small thing. It potentially frees people up for the human side of care.
That makes sense.
What else?
Well, improved access to healthcare was mentioned by about two-thirds, 66.7%. And also things like cost savings, which is always important, and better diagnostic accuracy.
So making healthcare potentially more accessible and more accurate.
That's the idea. They see it as a tool, a really important one, for reducing things like nursing workload,
Okay.
improving how patients are monitored, and even helping with really complex stuff like analyzing genes.
Okay, so that's the now. What about the future? Were they generally optimistic or more cautious looking ahead?
I'd say definitely leaning towards optimistic. There's a strong belief that AI is going to really enhance patient outcomes.
How so specifically?
Patient monitoring and, crucially, early prevention detection. Over three-quarters, 76.2%, highlighted that potential. Catching things earlier makes a huge difference.
Absolutely. Early detection is key.
Right. And another big one, mentioned by nearly half, 42.9%, was the potential for AI to help reduce medical errors.
Wow. That would be a game changer for patient safety.
Exactly. So definitely a lot of hope pinned on AI's future role.
It sounds incredibly hopeful, yeah. But, I mean, with technology moving this fast, especially AI, there have got to be challenges, right? Hurdles.
Oh, absolutely. The optimism doesn't ignore the difficulties. The study clearly laid out some major concerns.
Like what? What were the biggest ones?
Technical adaptation was a big one. Two-thirds, 66.7%, saw just integrating these sophisticated AI systems into existing hospital setups, the legacy systems, as a significant hurdle. It's not plug and play.
Right, the practicalities.
Exactly. And maybe a bit surprisingly, over half, 57.1%, mentioned a concern about losing managerial control. Sort of who's ultimately in charge when AI is making recommendations.
That's an interesting angle. But what about ethics? That always comes up with AI.
And it came up huge GE here, data privacy. An incredible 95% of these professionals flagged data privacy as the most significant ethical challenge.
95%. Wow. That's almost unanimous.
It really jumps out, doesn't it? Concerns about informed consent patients understanding how their data is used by AI and accountability, like who's responsible if an AI makes a mistake, those were also seen as critical.
So the human ethical elements are really front and center for them.
Definitely. And here's something else fascinating. You know how there's often talk about AI taking jobs?
Yeah, that fear comes up a lot.
Well, in this group, only 2 out of the 21 professionals were actually worried about AI replacing their jobs.
Really? Just 2?
Just 2. It strongly suggests that these professionals, the ones working with it or seeing it implemented, view AI more as a tool to help them, to augment what they do, not to replace them. That really challenges the common narrative, I think.
That is interesting. It shifts the perspective quite a bit. So
Hmm.
95% worried about data privacy, but hardly anyone worried about job loss.
Hmm.
It really highlights where their priorities are. Trust, data security.
Precisely.
So pulling this all together,
Hmm.
what's the main takeaway for us?
I think it's this kind of dual reality, right? On one hand, you have clear optimism from healthcare professionals. They see real, tangible benefits from AI now and even more potential for the future, especially in improving patient care.
Okay, the positive side.
But balanced against that are some very significant challenges. Getting the tech integrated is tough, and the ethical questions, particularly around keeping your personal health data private and secure, are absolutely paramount in their minds.
So understanding what they think, these professionals, is pretty crucial for figuring out how AI actually gets rolled out into your healthcare, the healthcare you receive.
Absolutely critical. And maybe it leaves us, and you listening, with this thought to chew on. Given that overwhelming concern for data privacy, that 95% number among the very people delivering healthcare, what does that truly tell us about how vital human trust and careful oversight are going to be as AI becomes even more embedded in something so deeply personal, so critical as our health?